I am Dr. Sridevi KN. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. So, what are the causes of rectal bleeding and is it always because of colon cancer is something that a lot of people ask us. Now, rectal bleeding or lower GI, the lower gastrointestinal bleeding as such, is an extremely vast topic and several textbooks have been written about just bleeding from the rectum. So yes, colon cancer is definitely one of the causes and it is increasingly becoming a more common cause in present day. But it is definitely not the only cause of rectal bleeding. But bleeding, whatever the cause may be, is a sign of emergency and it definitely needs to be checked. Whether it is something as simple as a fissure or a cut in your anus or the other extreme where it could be colon cancer. Unless you find out the cause of your rectal bleeding, it should not be neglected, and once you determine the cause of your rectal bleeding, then your appropriate treatment can be started. So when it comes to colorectal cancer or most cancers of the gastrointestinal tract, the reason why cancers are dangerous is because that they don't normally show any symptoms. So patients come to us at quite an advanced stage before they realize that there is something wrong with them. But however, there are some symptoms or signs that you can watch out for if you're worried about colon cancer. These, however, I must remind you that they are not specific for colon cancer. They can occur in other diseases as well. But some of the common symptoms that we see in colon cancer are these. First of all, bleeding. So if you notice any blood in the stools or any dark looking blood, okay, it may not look like fresh blood, it may look like dark brownish colored blood or even black tar like blood. So these are the various ways in which blood can present in your stools. So if you notice this sort of black or red blood that you have seen along with stools or separately from the stools in your motions, then this could be one of the signs for colon cancer. This may be painful. So not necessary that when you have bleeding you have pain as well. So it could usually be painless bleeding that you notice when you are passing stools. The second thing is sudden change in your stools habit. So if you are somebody who passes stools once or twice a day or maybe once in 1 or 2 days, and suddenly you notice that your bowel frequency has changed a lot. So you're either passing stools every day more than 3 to 4 times or you're not passing stools even though it's been 3 to 4 days. So if there is a drastic change in your stool pattern, then that is another sign or symptom that you can observe which can be due to colon cancer. The third thing, you may feel some swelling or growth in your rectal region as well. So as you're passing stools, you may notice that there is some block or you may feel that there is something present there all the time even though you feel that the stools have been cleared completely. So or sometimes when you pass stools, when you apply pressure, you may feel that something is slipping out from your anus and then after you pass stools, it may either stay outside or go back inside. So it may feel like a small fleshy thing that comes out when you pass stools. Or it may be something that just feels like a mild pressure that always stays inside your rectum or your anus and it does not relieve even after you have cleared your stools completely. So mass or swelling is another way in which colon cancer can present. Another very rare way in which it can present, of course, is pain. If that swelling comes out and it gets stuck or it has a superadded infection or it develops an ulcer on the surface, then it can cause pain as well. A painful swelling in that area, around your anus area or outside your area, is most commonly seen in anal cancers, but in colon or rectum cancers, usually this stays inside your body. Other systemic signs that you can look for is that you have generalized weakness, you may have loss of appetite, you may have loss of weight, and you get tired very easily and you're not able to carry out your daily activities as well as you used to. Colorectal cancers are known to have genetic disposition, but you must know that this is less than 1 to 3% of the population. So what we call as genetic cancers and sporadic cancers. So majority of the cancers that we see are sporadic, meaning that there is no family history. It is not that your father, your mother or their immediate relatives had cancer, so you get cancer. That does happen, but very rarely and in very few families. And these families have certain genes such as FAP or HNPCC. These are cancer syndromes which are present on specific genes in your body. So if these are present in your family, then they will be transmitted to you as well. So in these cases, you will have a very strong history that you will have a first degree relative, that is either your parent or your sibling who has undergone treatment or who has been diagnosed with cancer at an early age. So in these patients, yes, and to form at a much earlier age than it is in the normal population. But whether it is a genetic reason or whether it is a sporadic reason, cancers can occur at any age, although there are certain norms that they follow. Like most cancers we see, as colon cancer especially, we see that the incidence increases with age. So the older you get, the more risk it is for you to develop a cancer. But present day, probably due to the change in environment and consumption of more carcinogens and preservatives which have unknown consequences, we have started to notice that cancers are developing even in a much younger population as early as their early 20s.